I'm Rachel Forbuster. I work at Health Innovation for North East North Cumbria, formerly known as the Academic Health Science Network. I lead on this amazing forum, bringing together people from across our region and really helping to try and share best practice to help facilitate better outcomes for our citizens. So we've just got a few housekeeping things. Make sure that you're on mute. If not, our wonderful Leanne will likely mute you. We are recording, as I've mentioned. You can use CC captions, which can be turned on at the bottom of the screen, and we are using the chat function for any questions. So we've got two great presenters today, so please drop any questions you have for them. Leanne and myself will monitor that and pick them up, and then we'll present those questions back to both Tim and Adam throughout the event. So just a little bit of context about ourselves. So we are the Health Innovation Network. We are one of 15 across the country. You can see this map on the right-hand side about where we are located. We do cover a very big area, as you can imagine, with North East and North Cumbria. And it's really to help spread and adopt innovation at pace around our region. We have a number of organisations who are partners, including academia, so all of the universities in the region, the NHS, including primary, secondary care, trusts, etc. But we also work with innovators, our local authorities and third sector, and we support things around regulation, funding, investments, etc. Lots of different things. And our main aims are really to transform patient safety, to look at how we generate economic growth in our region, so through supporting innovations, adoption of those and creating jobs, etc., but also about improving the health of the population that we serve. And that's where our digital inclusion fits into very nicely. So just to touch on and bring us back to the reason we're here, I'm sure everybody has probably seen this by the Good Things Foundation. They produce this infographic every year and give some brilliant statistics, which really help to drive forward what we need to look at and some of those priorities. So please, if you haven't seen this, you can download it free of charge on the Good Things Foundation, and you can use it as part of your materials moving forward. I won't read those statistics, and you probably can't see them all on there, but there are some very interesting things in there, including 1 million houses losing broadband access since the cost of living crisis. So how do we support people like that in that digital inclusion space? And to me, digital inclusion is lots of things to everybody. You can see on the screen there some of the things that kind of describe it. How do we give equitable access? How do we improve digital literacy? Increasing the confidence of people to be able to use technology. But equally, how do we get them access to the internet with that example of broadband? And we use this triangle to kind of touch on what are the devices that they have access to, and if they haven't, how do we get them a device? How do we provide internet, or how do they get internet? How do they tap into social tariffs, etc.? But then finally about their skills, and how do we link in with some of those local services, often organised via the local authority and charities, etc. And how do we encourage people to go and access and get support around some of those essential skills? So I'm delighted today that we're joined by two brilliant speakers. We've got Tim Brazier, the Managing Director of Thrive by Design, and does lots around the design space. He's been working with us and helping support our strategy on digital inclusion for the North East and North Cumbria, but he's got a great wealth of experience and background in digital inclusion and how we look at doing something different. We've also got the wonderful Adam Parnaby, who is doing his doctoral trainee at the moment, and he has a great idea and concept, and it's how do we support him to bring that to life, and he's from Newcastle University. So without further ado, I'm going to pass over to Tim.
Thanks, Rachel. Hi everyone, thank you for having me today. I shall share my screen and hopefully see some nods when I say, can you see that? Is that all good? Perfect. Lovely. So my name's Tim Brazier, and as Rachel said, I'm from Thrive by Design and head up the team there. So I'm just going to give you a bit of an insight into my kind of experience, but also some of the work that we've been doing that's really helped us understand digital inclusion and digital exclusion, of course, as well. and how our kind of thinking and my thinking has been challenged over the years, and kind of it's a very grand title of a slideshow, isn't it? The evolution of digital inclusion sounds quite grand, but yeah, just my thinking and the thinking of the team as we've kind of grown, our understanding through the work that we've been doing over a number of years. So a little introduction to us, I guess, just to give a bit of context. So Thrive by Design, we're a service design team, actually based within the NHS. So we are actually, we're an NHS team. We're hosted by Leeds and York Foundation Trust, just further down in Yorkshire. And we've been around for about 8 years, coming on 9 years now. And our purpose really and our mission is to design equitable access to health and care services. And that's evolved over the years. So we started out very much at the fore, like really pushing digital technology. How can we get more digital technology, more innovation within health and care services, open up access for people, that sorts of things. And obviously over the years, as that's evolved and more of that is happening, a lot of our focus has come much more around the people side of things, and actually how is this having an impact on people and on their access to being able to engage with and use health and care services that they need to. And yes, like I say, we've been around for 9 years, lots of kind of experience from all across the country. And in 2020, just as COVID kind of kicked in, we launched a program called the Inclusive Digital Transformation Program, which was really an opportunity that we saw to shift the thinking a little bit from or to help us understand how the NHS as a system can be thinking about inclusion within digital transformation right the way through. So it's not an afterthought, so it's not an add-on that's kind of put at the end of a project where they go, okay, so who's excluded from this? How do we kind of add some things for them to make sure they're not, sort of thing? So how do we embed it and ingrain that in the way that we're thinking? So that's just a little bit about us to set the scene. Rachel just touched on there the work that we're doing at the moment up in North East and North Cumbria. And I've seen Wally join the call. I think you can see Wally's face there. We've been working really closely with Wally and the team on the digital inclusion strategy and strategic plan for the ICS. And we were kind of brought in and asked to come and join that work to really help make sure that that strategy is based on the lived and living experience of people across the area that we're covering. Trying to identify who is impacted by this and how they're impacted, so really get to understand what's that really look like for people. And then in the strategic planning bit, it's like, where do we start? Where do we kind of really turn our attention? How do we prioritize this work? Because it is vast and complex and kind of really huge, and I'm sure most of you are already aware of. Every corner you turn when you're looking at digital exclusion and trying to understand it, you kind of find another kind of world that you've not currently had access to really understand what's going on for people. And yeah, the goal is to develop knowledge, tools, approaches, and things that others across the region can use to kind of tackle it. So the evolution of digital inclusion. So my experience, I've just kind of put the organisations I've been working with over the last, so back 2016, so what are we on now, for about 7 years, where I've been working quite specifically looking at digital inclusion. So I joined the Good Things Foundation back then, and headed up their service design team, and was fortunate enough that coincided with the launch of a new phase of the NHS's widening digital participation programme. I'm not sure if anyone's kind of seen that. So it was a 6-year programme in all, and I came in 3 years in. So the first 3 years was focused on kind of understanding the problem at scale, did a lot of work around Good Things Foundation's Learn My Way platform. So how can we kind of create content for digital skills, specifically looking at health and care, that sort of thing. There was a lot of kind of research and data kind of crunching gone on to try and understand the kind of return on investment of digital inclusion within the NHS, that sort of thing. So that was kind of the first 3 years, and then I came in, which was much more about understanding people's experiences and the different kind of complexities which can result in people being digitally excluded from health and care. And we ran 15 pilots across the country, which was going into different areas, focusing on different kind of needs, which was really interesting to kind of see from a human perspective where digital kind of plays a role in their lives and how it can play a role in trying to overcome some of the barriers that they face to engaging with health and care services. But what I put on the left here is kind of, this is where I first started, or how I first started to look at digital inclusion. So very much about, does someone have a device? Does someone have a connection? Do they have the skills to do it? Which kind of ultimately results in the confidence to be able to use digital to do what they need to do. And that is still true. So I'm not saying this is not true, just our evolution of thinking around it. After Good Things Foundation, I spent a couple of years through COVID at the probation service and really understanding how actually so many face-to-face services needed to rapidly go online, and then the challenges of people that have been kind of out of society, out of mainstream society, and how that kind of impacts their ability to engage digitally, and the amount of things that someone like leaving prison will need to kind of know and have in place to be able to kind of engage and reintegrate back into society, and digital plays such a huge part in that. So it was a really interesting kind of 18 months, 2 years, kind of taking myself out of kind of health and care and into that space. And then I joined Thrive by Design just over 18 months ago, which was brilliant to come back into the NHS and into health and care. And that's where the evolution of this has really kind of kicked in. And the first thing was how we started to break that down a little bit. So it isn't just about a device and a connection and the skills, but what are all the other barriers and the other kind of factors that impact somebody being digitally excluded. And we started to group them from a kind of life context, a digital and a systems perspective. So it's not just access to a device, like you say, but this kind of people's age and relationships, they might be living precarious lives, their physical and mental health conditions, language, literacy, all that sort of stuff comes in. I'm really sorry, I just need to unlock the door because I've locked my family out of the house. I should be back in 2 seconds.
Well, that has to be a first. We've never heard that one before. Always good, never a dull moment in the digital inclusion world. That's good. He's got a 3-year-old, so he definitely doesn't want her to be locked out of the house when it's pouring down with rain outside.
I'm back. I think that's, physical exclusion from the house that I've just caused there. But yeah, so we kind of really started to unpack it a little bit and realize that all of these are kind of interrelated, quite complex and dynamic kind of factors there that can affect people's ability to engage. And a couple of the kind of key things that come out of our work around that is, the first is that digital inclusion is not a static state for people. So again, my thinking was originally, give them a device, a connection, the skills, the confidence, they're in the club, they're through the door. The rest of their life is digitally included, kind of beyond there, but it's really not, as you can see from those kind of factors above. Those things can change quite quickly for people. And can happen overnight, that sort of thing. So, sorry, I missed the slide. Sorry, it's gone there. So digital inclusion is not a static state for people, and it can also be seasonal, and that's a really interesting thing that's kind of come out more recently in data. So we've been attending the Citizens Advice Bureau's kind of cost of living briefings and things like that, and seeing some of the data there about people's needs and priorities changing throughout the year, and them having to prioritize different expenses rather than some of the things like broadband in the home or data contracts on their phone, that sort of stuff. So a couple of things that are really stuck out to us. And the point that I just missed there, sorry, was that digital inclusion can't be tackled in isolation of other inclusion needs. I think that's a really good point, and got reiterated through this work we've been doing with North East and North Cumbria because of all those kind of multiple complex factors in there. So we've been asking ourselves 2 questions through part of this work as we're kind of setting up the strategy. The first is around that. So how do we support people to access the resources that they need to be able to access and engage with the health and care service where digital is playing a role? So again, kind of evolving that, what are those resources that people need? Because it is beyond that kind of initial thing. So this is just a bit of a visualization that we've been working on. So how can you kind of help kind of describe the things that people need, the resources people need access to be able to engage digitally? But also, how do you kind of understand that that's dynamic and that changes? So this is just a first version of this that we're kind of playing about with. So it will definitely evolve, but we've got around the outside there some of those different factors, like a reliable internet-enabled device, any assistive technology or to support accessibility. So there's needs for various different people around that. Support, that can be advocacy, it can be kind of proxy support to be able to access things, just having someone there for kind of psychological support and safety around accessing services. Have they got the confidence and motivation that using digital will be relevant to them? Reliable connection, skills, as we've kind of talked about. Is the information about how to do things digitally accessible and complete for them? And we've seen plenty of occasions where that's not the case. So it goes beyond the digital thing itself. And do they have a safe and accessible environment to be able to engage and kind of do that? And like I say, trying to understand and visualize how that can change for people. So just using this kind of visualization that someone is unlikely to have all of those things in certain circumstances. So they might have a reliable internet enabled device. It might be fully accessible to them, but some things might not be. Some things might be a little bit more precarious. So it's about how do we use something like this to identify the barriers and the kind of challenges for different people, and could something like this help us kind of shape the services and support that we need, and just the awareness of this, so we can start to tailor some of the support from a care and kind of health perspective. So that's the first question, but we then start to really challenge it a little bit and go, okay, and this is an interesting statement, I think. Digital inclusion is only as good as the thing we're including people into. And there was a video that someone shared with me, which was really interesting. It was where someone was walking up to, I think it was a TikTok video, walking up to a door, big wooden kind of door on a big red brick building, with a button to automatically open the doors for accessibility. And they press the button and it opens up, and as they go through the door, they're just presented with a huge marble staircase, and there's nothing else beyond that door. The door is access into that staircase. So it's almost like that metaphor of, we can do the digital inclusion work, we can help people access those resources, but is the thing they're trying to access and engage with accessible to? Is that inclusive for them? So this is the bit where we're really trying to shift our thinking a little bit and shift the NHS's thinking about understanding what our responsibility and our kind of accountability is around digital inclusion. So not just thinking about how do we fix the person, how do we shift that narrative that the digital things that we're putting in place are right, and we just need to go and fix the people that can't use it at the moment by giving them the devices, the connection, helping them with the skills, and assuming that that's the thing that we need to do. We almost need to kind of meet these things in the middle and be pushing from our side as well. So how do we fix the system? And a couple of things that are really key in that are that digital is not the service that we're providing. And again, that's something that we've come across time and time again when we're going into services across the country. We're brought in to focus on a digital tool, and the kind of assumption is that's the service, that's a thing that needs fixing, whereas actually that is just playing a part, that's playing a role in enabling access to a service. So we really need to start thinking about what that service is for people, and seeing where digital plays a role and kind of bringing that in as well. So the second question that we're really asking ourselves is, how do we design health and care services to enable informed, safe and equitable access for people where digital plays a role? So that's the kind of second challenge. And again, playing about with the diagrams, really trying to help a service understand what is it that they need to kind of understand and be thinking and considering to try and answer that question. So do they have an understanding of what their end-to-end service looks like, what the different channels are used across that service to access it? And that's in there because we've seen time and time again, we've gone and worked with services where they don't. We've gone and explored it, we've looked at it from the people's kind of experiences perspective, and they don't realise where their service is kind of starting for people, because it's not in that building where they are, it's kind of before that, and they're having to engage with, how do I even become aware that this is something, or how do I start to engage with them so I understand what's going to happen when I kind of engage with the service? All of that sort of stuff comes in. So how do we support services to understand that, to offer and enable equitable choice about how people can engage with their service? So that whole point about not everyone can use digital, not everyone will choose digital, so what are the other options for them? And showing meeting some of that accessibility kind of standards and legislation already, because there's so much in there. There's a legal standard right across the NHS, from the Constitution into things like the Equality Act to Health Act to accessible information standard. There's so much already in there that would give, if we just did all of those things, would be a much better place with this. But it's really hard and complex to ensure that and kind of govern and track that as well. So meeting the accessible information standard, how do we make sure we're asking about and understanding and making adjustments for people's needs? Again, the accessible information standard really sets that out. How do we support our staff to gain and grow their skills? And how do we ensure we've got a consistent and valued approach to asking people about their experiences of using the service? Because that's where we're going to learn and we're going to grow, if we really understand how this is really impacting people when they need to use it. So yeah, so that's just again, we're just playing about with that a little bit, but I thought it was worth showing it as a visual to kind of see how these things can be different for people. So a service isn't necessarily going to be hitting kind of top marks on all of those things, but they might be strong in some areas. And if we think about across the spectrum, across the kind of geography that we've got just in North East and North Cumbria around, but then the rest of the UK, how do we spot patterns and spot actually there's a real need here for all services to understand that? Or there's some services here that are doing great work. How do we learn from them? How do we replicate and kind of share some of that work? So that's me. That's where the kind of thinking's got to, of really trying to shift that kind of narrative around not only understanding the complexity of the needs that people have when they're trying to engage with something digitally and the resources that they will or may need to have access to. So how do we support that? But also, yeah, what can we do with our services? What can we kind of make sure that we're doing to meet them in the middle, to push ourselves, to make ourselves more accessible? And one of the first things that I learned when I was at Good Things is that kind of good old statement around hard to reach people, and kind of really shifting them, flipping that on its head and going, people aren't hard to reach. Our services are hard to reach for people. So how do we kind of take more steps further towards them and making that more accessible to them? So yeah, hopefully that was useful and insightful, and hopefully prompt some questions, because definitely not saying with the experts, we're just kind of sharing about what we're learning and what we're seeing and how that's being experienced by people.
Thank you so much, Tim. That was great. I definitely picked up a new couple of tips there. We've had a great comment from Chris Foreman in there about the front door. It is about designing that whole service and not just the front door. We've got a clap as well, which is excellent. I've got a couple of questions, if that's okay. So first, you mentioned about cost of living, the impact that that's having. So what do you personally feel? What are you seeing, when you talk about lived experience, and you mentioned broadband as an example, but how is it excluding people more? In your thoughts?
I think it's that prioritisation bit, I think, as much as anything, where people are having to make really difficult choices, and they're having to cut things out to be able to afford the heating, the electric, the food that they need within their families. One of the things that we're seeing as well is or what we've heard is, traditionally a lot of digital inclusion funding is really focused on that, almost like the skills part of it. There's a lot around device and stuff, but measuring digital inclusion based on a skill level, and there's the national, is it the essential digital skills framework now, isn't there? So a lot of focus is on that, whereas actually people coming through the doors of the voluntary and community sector organisations across definitely across the area that we're working in at the moment, but across the country really, are much more holistic. They're much more, there's some immediate things going on for them that they need solving. And that's been a pattern through work that we did at Good Things, where actually what you need to focus on is what matters to that person most first. So try and understand that. And for some, there's stories like where people have been diagnosed with a long-term condition, they've been advised that they should use some part of digital to kind of support them, whether it's an app to monitor their diabetes, that sort of stuff. That's not their priority. That's a big life change for them, and they're now thinking about, how does that impact my ability to earn, my ability to actually go out to work, spend time with my family, what's the impact on them, all those sorts of things. So actually, when it comes to digital inclusion, they'll have other priorities first, and that's what we're seeing now. It's more about, yeah, I need to access the service, but I've got all this going, I can't. There was a statement that someone said to me at the beginning of this year. People have been talking to them and saying, I can't afford to be ill. And they don't, and that was a very, like, that was real. That's me, like, I can't afford to think. And I was working with a cancer service. There's people that can't afford to be unwell. They can't afford to have cancer right now or deal with it. So they're just putting it in the background because their priority right now is, I've got to get food on the table. I've got to make sure my kids have got some warmth in the house. I've got to make sure that they're fed, all that sort of stuff. My health is not a priority. So we've got to be understanding that and understanding where we might be a few steps removed from the real measurable, oh, this person has been helped to get the digital skills and the inclusion that they need to be able to access this secondary care service and or this remote monitor or whatever that kind of measurable is. But the first steps to that are actually solving some of those bigger problems for them. And we need to kind of understand what our responsibility is and how we can contribute to that. And sometimes it could be, and one of the things coming out of this bit of work is, how do we fund that a little bit wider? How do we actually, when we're putting funding out into community and voluntary organisations, how do we blur the lines a little bit so that they can adapt and they can go, actually, this person will really benefit from being online. But the first thing I need to help them do is understand English, for example. That's kind of a big barrier for a lot of people. Or is it that I need to support them with a housing application first or something like that, knowing that that's allowed? And that's a kind of thing that we're seeing, a barrier within that sector as well, where they feel very squeezed and constrained. And that happened when we were at Good Things as well. We saw that quite a lot with the way that voluntary and community sector organisations have to be very creative with the funding that they get. So, yeah. Sorry, that was a long answer.
No, that's a good answer. We're doing some work with the renal team, and they did a deep dive statistically into 103 of their patients on dialysis, and 38% of them did not have a smartphone. Yet they were prescribing this digital tool to encourage you to better health outcomes, fill this survey out online, etc. But actually, 38%, I mean, that's a fair chunk of patients, which goes against some of the national statistics. But what were the reasons? Kind of going back to, well, I haven't got as much employment opportunities. I can't go out and earn because I've got this, I'm in dialysis 3 times a week, etc. So it can be really interesting and to kind of do that deep dive. Got a couple of other questions. Now, you touched on what are like the inclusion needs, not just digital. So just for our audience, what do you see as those other inclusion needs that they may need to consider as well as digital to help overcome them?
Well, language is probably the thing that's stuck out the most within the work that we've been doing more recently. So we spoke to a couple of organisations across kind of Newcastle, Tyneside area, who are supporting people, refugees, asylum seekers that are in the area, and there's some amazing work going on to support them. But again, that was one example where one of the organisation had been funded, I think it was through Good Things, to do digital inclusion work. I think by the end of it, they've met all their targets through the funding, but I think they got to a point where they had 300 or so people on their list of people that wanted to do the digital inclusion stuff, but English wasn't the first language, so it wasn't accessible to them. So they weren't able to kind of find the funding or support that funding at that time to be able to widen that and go, actually, we can get some translators in. We can do some work with that and create an accessible space and an accessible option for you to come in and bring that together. It's things like that, other inclusion needs. It can be, like say, there's all sorts of other kind of needs around housing and stuff like that. So that need to be considered. Access to funds as well. Do we actually just need to sort somebody out to be able to access the benefits they're entitled to or something like that, or the funding they're entitled to, things like that alongside this that are just going to be barriers to them being able to think about and engage with digital. And there's trust within that as well, which I'm pretty sure is a theme we're all very aware of when it comes to digital inclusion. Definitely.
So before we ask Wally his question, I've got one more from Kate Holmes, which kind of fits into that area, about an issue about communication, but change with patients in advance so they are able and can learn. she was talking about, in my experience, change happens and patients, including myself, caught by surprise, not good and very stressful for many individuals, including but not just people with autism. So I guess that's a different group of patients, as you know, kind of that inclusion barrier. So you know, do you have any findings around that, Tim, and from the research that you've carried out?
Yeah, I guess we're doing some work with Oxford University actually around remote consultation in primary care, and that's come up a lot, where we've been going that the digital part of that is the environment where the interaction kind of happens. So it might be a platform like Attend Anywhere or somewhere. So that's kind of all designed and kind of put in, and the processing, the steps and everything like that. But that kind of helping people understand what to expect and what they will need to do, and how they will need to kind of might have to set something up, might need to have access to certain things available to them, all that sort of stuff. It's kind of missed a lot of the time. So setting that up and being really inclusive and accessible with that information and that communication as early as possible is something that we've seen, yeah, has been a real barrier if it's not there, because people are kind of turning up to appointments not sure how to do it. Do you know what I mean? Just expecting to be given a button and it works kind of thing. So yeah, there's a lot in that, in turn trying to, and again, it's that whole service thing to try and understand actually there are other points of somebody's journey where these things can come in. So when they're booking an appointment, which might be over the phone or in person, that is that an opportunity at that point to start setting those expectations, to provide people with that information, to get them kind of set up and ready, so it's not a shock and not a surprise and not a horrendous experience when they've really been waiting for this appointment, really hoping for a good kind of clinical outcome of that conversation, and they get to it and they just can't have that conversation because they've just not understood or not been supported to understand what they would need to do to enable that. So yeah.
And the last time we had Julie Tucker, who talked about the reasonable adjustment flag. So that's hoping a support moving forward, that minority of people who do need adjustments in order for them to access the right services. So
on that last point as well, actually, we're doing some work in West Yorkshire, and it came up with an idea about having an app to support people to communicate their needs. And one of the big findings out of that, before we've got anywhere near designing an app or anything, is that there are people, and I think you mentioned kind of people with autism, but not just kind of in that circumstance, but where it's actually hard to understand and hard to articulate what your needs are. So there's a lot of work that we're hoping to kind of do there, working with like content designers as well, to try and think about what is the way in which we can ask questions and support people to be able to understand, and how they can articulate what they would need when engaging with the service, so that it supports that reasonable adjustment work and is understood. And I think a big part of that is sometimes just us doing a bit of work as well and saying, what could we do to make things more accessible, and sharing that so they've got something to kind of look at and go, oh yeah, that would be really useful for me. Because if they don't know it's possible, then sometimes it's really hard to kind of ask for it. So
all that thought for the last question that I have for you, but I wanted to invite Wally, because he did have his hand up earlier, and Wally always has a great insight into this area. So Wally, if you are still on the call.
I am, yeah. No, it's just a touch on, obviously, been working with Tim and the team for the last 6-7 months, seems a hell of a lot longer. And some of I meant that in the nicest possible way.
Yeah, I'll take that as a compliment, Wally, don't worry.
But two of the things that stand out for me, well, there's a number of things. One, we keep doing the same thing and we keep expecting the same results. We keep getting the same results, and it's usually excluding people rather than including them. And that's a system issue. It's not a people issue, like Tim said before. And we tend to think we fix people's problems when we've actually just internalized our systems. So there's some massive issues about system organizational changes as far as what we deploy and who we engage with and communicate with to test it. We very rarely test anything we push out with patients, or if we do that, we do it in very, very small percentages. And I think part of the work we've been doing with Tim those two schematics, which will be in our strategy, I think are that they need to be in everybody's mindset when they're developing any kind of digital deployment, or else we'll just end up with the same things what we've got before. I mean, digital covers the complexity of health inequalities right the way across it, but we need to shift from that being a responsibility of those people who are sitting in digital to the responsibility of every person who's employed or who's a volunteer, in creating a much more accessible route into digital. And the last thing I wanted to say, and again, it's the work we've touched on, how we fund organisations. If I'm being completely candid, it's old-fashioned, traditional ways we do it. And whoever writes the best application based on a criteria, we tend to accept that without doing any real digging into those people who've applied for that. And if we start listening to community organisations and patients in general, the outcomes for them funding processes will be a lot better. We're still dictating how that's worked, and we need to be told how it needs to work rather than us telling people how it works. And hopefully a lot of the stuff that's going to come out now, the NENC strategy will focus a lot on that. Whether my peers or execs will agree will be, I'm sure they will in discussions with them. That's what's come out. But we need to challenge ourselves, or else we're just writing another strategy without any real impact.
Very wise words from the wonderful Wally. Thank you. We're moving over to Shirley Van for a question.
It's not really a question, but it's just following up on what Wally was saying. That I think it's not just digital inclusion; it's digital in general. That we in the health service we've got a really bad habit of digitizing poor processes. And whatever world you work in, that's not a great idea. You know, we should be using digital to, well, redesigning the processes and then layering the digital over the top, not just digitizing bad processes. And I don't know quite how we change that. So we review those processes, we look end to end, we start where it needs to start, design those processes, and then overlay the digital. But it just feels a bit like it's the other way around at the moment, that they just say, well, stick it, you know, if you digitize this instead of not being digital, but actually it's the way the service is made up. And I think that's a habit that we've got in the NHS, which isn't just around inclusion, it's around a lot of systems that we do.
Absolutely, yeah. Surely.
Yeah. I mirror that and see that. So it's really important. And obviously, Tim, from a design point of view, you know, that's really essential. You're right. And we've thrown, think of COVID, Shirley, and everybody else in the call, we've thrown so much tech at all of our staff, and we've never really stepped back to have a look at, well, what's the process in which we use that, and how do we effectively use that, and how do we support and make sure we're not excluding people as a result of that. So we certainly have got a lot to learn. So I need to move us on. Thank you for that wonderful contribution, Shirley. We've got one question from Andy and then a final one from me, and then we're going to move on to Adam. So Andy, and we've had Kate responding, which is the beauty of the forum, and people keep chatting in that chat function because that's where you share your best practice, etc. We can print it off afterwards and share it. But around accessibility and usability of technology, but for the deaf and blind communities. So, you know, you've got an extensive background in research. Have you came across, you know, or what's good practice out there, Tim?
So it's not something that I've been directly involved in, if I'm honest. I know there has been quite a lot of work done around this, and I think there's some really good resources that people have shared around RNIB and things like that in there. One of the big things that sticks in my mind is through the widening digital participation work, there was a piece of work done in West Yorkshire, actually, a small kind of idea of really engaging with people who are deaf or had hearing loss, And one of the key things came out of that is that how digital can be a massive enabler for them in terms of being able to access and engage with all sorts of parts of their life and services specifically as well. And the thing that really stuck in my mind was the point around there's so much already available on like a device that someone might have, like a mobile device, a smart device. There's accessibility kind of features and settings in that, but there is a lot less focus on supporting people to understand that than there is in promoting apps and things like that, which cause a lot of confusion because there's 15 different apps for the same thing that you can kind of choose and things like that. So that's going back about 5 years ago that I was kind of on the very periphery of a bit of work that I was kind of hearing some insights from. But yeah, just that was one of the challenges or insights that came from that work. But like I say, it's not something that I've had direct kind of deep insight or kind of experience of, if I'm honest.
That's great. My final one in less than 30 seconds. To our audience, what would your top 3 tips be about making a difference?
Oof, it's a big shout.
I know, in 30 seconds.
I think number 1 is if we want to understand any type of exclusion, you have to go and spend some time where people are, where that exclusion is happening. Go and be there, see it, feel it, and understand it, because it's not what we all think, and it's all every time is very different. So if you get an opportunity to go and spend some time in a community setting where you will see and hear this, do it. And even if that's like in our life, we're talking like health services, just go and spend some time in the waiting room or something like that. Just sit, doing your work, catching up on your emails, things like that, but just experience and see the challenges that people are having, because some of them are really easy to overcome and don't need any technology or any project to do. There's little things that we can do that others aren't seeing because they're there every day. That'd be one. It's a really tough question, Rachel. 2,
I like to give tough challenges.
Keep talking to those community organisations as well, because they're doing some incredible work and they're understanding their complexity. Real kind of innovation is happening every single day because they see people walking through their door who have the biggest, most complex challenges that might be at a point of crisis, and these people in these community organisations just look around them and see what they can lay their hands on and pull it together and support that person with what really needs and really matters to them. And that's where the kind of trust starts to build, and that's what we can learn a lot from in those situations and in those opportunities where we come across people that are in a really bad place for whatever reason. We can learn a lot from the way that they do it. And the third one I'm just going to say is just to that point about we need to really start understanding services, what that looks like from the perspective of the people that are using them. Where does it start? What are all the different points they have to go through? And what are we doing, A, to get in the way of that, and B, to enable people to get through that as easily as possible? Because no one wants to go into a health and care service experience. I mean, most of the time there are some exceptions, but yeah, how do we support people through what is often quite a tough time as well? So that's what I'd say.
Well, that was brilliant. Round of applause for Tim. There's a physical one and some ones that are being clapped on the screen as well. I love digital. So we're going to move swiftly on. Thank you so much, Tim. Please stay around and listen into what Adam's got to share as well. And then we've got a sort of general catch up at the end as well. So over to Adam and your opportunity to share your slides.
Okay, thank you. If you just give me, excuse me, give me a moment while I really come to terms with how many windows I have open on this thing. There we are. So that should be a slide. Can people see some slides? Wonderful. Yeah. Hi, everyone. So I'm Adam Parnaby. I'm a PhD student at Open Lab at Newcastle University. So we are a design lab with a particular focus on civic technologies, co-production, the impact of technology on civic life. So we do stuff around health, but also education, planning, digital democracy, all sorts of things. My particular focus for the last 4 or 5 years now has been on digital access, and particularly interventions to support digital access. So a lot of my work, a lot of my research has been with the kinds of places that end up providing a lot of that frontline support for digital inclusion. So places like libraries, community centers. I'm a relative newcomer to the health space. So when I'm speaking, hopefully there are some things that are relevant in terms of health. But as Tim said, this is quite a holistic issue. And so I'm going to be talking about it in quite a holistic manner. I also have, so my background, my research is in design. That's what my PhD is UX, UI, user research. Those are the sorts of things like when I'm teaching undergraduates, that's what I'm teaching them. That's my background. That's kind of the lens that I'm approaching all this from. Also, in a personal capacity relevant today, I'm also someone with a chronic health condition with a lot of first-hand experience of NHS services recently. I'm in a fairly comfortable position in that I'm a very technically able person with the financial and the social means to do what I need to do digitally. But I do have some experience of these services kind of from the other side of things. So what I'm going to talk about briefly, so I've been saying digital access, and the title there was digital access. I'm going to talk about what I mean exactly by digital access. Then I'm going to talk a bit about the barriers that I tend to see to effective access interventions that I've seen throughout my work, and then my own attempts to address or sort of work my way around some of those barriers. So briefly, why digital access? So this is roughly 1 part academic pedantry to 2 parts a genuine challenge to the way that I'd like people to think about these things. So there's a lot of different words that have come into and out of vogue for this thing that we're talking about helping people to do computer stuff. So we might start with framing about the digital divide. So that was on the Good Things Foundation infographic. That came out of public policy in America in the 1990s. And personally, I don't like the digital divide framing very much. It's very binary. It poses this thing like even on the Good Things Foundation thing, there's some great research that went into that infographic, and there's some great information in there, and it conveys some really useful things. But if you look at that infographic, there's like the beautiful sunlit uplands of digital access, and then this sort of dark, dingy, digitally excluded world with like a dead tree in the background, and it produces this framing where you have these digital have-nots that we sort of view in this very deficit-based way, that there's something wrong with these people. We need to fix them. We need to sort of graduate them into digital inclusion, and then everything's fine forever. And as Tim was saying, that's not really true. Digital access is something that's much more seasonal. People can move into and out of being able to access things as life stages change, particularly as people age and develop complex health conditions. Then we get onto these words like digital inclusion and exclusion and digital poverty. And these words, I think, are more useful in that they talk about specific things that we want to do. So digital inclusion, the process of trying to get people online, get people using computers in an equitable way. But I don't think that's what we're actually here to do, if you think about it a little bit further. So if we're thinking about the problem I have with digital inclusion as a term for what we're doing fundamentally is that it presupposes that getting people online is always the solution. And there's a very fine line there between digital inclusion and digital enforcement, right? There are potential issues that you come into there where you're presupposing that because something is more digital, it is more good. And that's just not always true. As Tim was saying, inclusion is only as good as the service that you're including people into. And oftentimes we end up digitizing, as someone I believe said in the chat, we end up digitizing rubbish processes. And all that often all that serves to do is lock them in place. So I like thinking about digital access. So I'm talking about access. And again, this is deep academic pedantry, but in the sense of there's a pair of geographers called Rabot and Paluzzo who talk about access, and they're talking about access to natural resources primarily. but they have this lovely definition of access, which is the ability to derive benefit from something, which I think is a very illuminating way of looking at things, because that framing lets you look at something and say the sort of key question, which is this actually something that people are benefiting from? Is this something that people are enjoying? Is this something that is improving people's lives? Because if it's not, what are we doing here? What are we talking about, right? There's something that's a kind of corollary to this, which is that people frame digitalization frequently as a cost-saving measure. I would argue that frequently what it actually is a sort of cost-moving measure. You're diffusing the costs of digital access out into wider civil society. You're passing them downstream into libraries and community centers and into family support networks and other informal social networks of support that people need help, people need to use to get the help that they need. And sometimes that might be what you want to do. Sometimes you might need to do this kind of load balancing where you're distributing the costs of a service a bit more widely into civil society. But I think we should be aware that sometimes that is what we're doing. We're not being digital isn't a magic spell that makes the service better and cheaper. It's a tool in the toolbox. So that's why I talk about digital access, and that's why I say the goal is digital access. It's about having an open door that people can make the informed decision to step through. It's not about shoving people through it. Having said that, I'm going to talk a bit about why, from my observation, why some of this stuff is so hard. So this is all based on a couple of years of my research and going into the work of other people who are working in this space, not necessarily locally, but sort of academic literature from all over the world that's addressing this in various different ways. So one thing, and Tim discussed this really well earlier, is that this digital access, digital inclusion is really complex. There are a lot of different there are a lot of different sort of things that you need beforehand before you can get to equitable digital access. And there are a bunch of different ways of sort of slicing that apart and addressing it in different chunks. So this is one of those ways. You can think about the material needs, you can think about the skills needs, you can think about the social needs. But the point that I want to make is that these needs are also context dependent. So if you think about devices, for example, the right device for a socially isolated older person who wants to communicate with their family, maybe they're in a care setting, the right device for them is probably quite different to the right device for a working age single dad of two who has been out of work for a long time. Maybe they have some complex health needs, but they have a requirement to keep looking for work. I don't know if anyone has tried applying for a job with only a smartphone, but it's not a fun experience. But that could be a perfectly serviceable device for someone who just needs social connection to combat isolation. All these things are going to be different for different people in different times and places, and that can change throughout their life course. So that's one reason why this is really hard. Another reason is cost, and I'm not just talking about money spent on interventions here. I'm also talking about things like when you're deploying a new intervention. We've kind of touched on this a bit. There's also the time spent learning, communicating how things are changing. There's the time spent on that kind of transition period. There's also maintenance. Devices become obsolete. Websites need updating. It's not just about the start of the thing. There's costs that sort of go into eternity for these things if you want to keep them operational. And there are also effective costs. So if you're bringing people into the online environment and if you're kind of rushing them into it, you're exposing them more to risk of being exposed to misinformation, to loss of privacy, to being surveilled. And there are segments of the population that have legitimate resistance to that. If you're forcing them to develop an online life and they don't want it, of course, they're not going to engage. And there are reasons why someone might not want an online life, and we need to take those reasons seriously. So a lot of the time, what I and other academics working on this have observed is that access work is, you need to account for what the costs are and to what degree they are worth it for the service that you're providing. My slightly provocative sort of one-liner on this is sometimes equitable digital inclusion is keeping your damn phone line open. sometimes that is just the correct thing to do, or sometimes you use digital to take some load off a service so that your in-person service can be more effective for the people who need it. But how you draw that line as to who needs it can be quite fraught. So these are just things to be thinking about, and they're adding complexity. And these two things together come to a really big one. So this is the scalability problem. So basically, because all this is so complex, often we observe that the places and the people that are best in position to support individuals and communities are closer to them. So it's the local community center, it's the local library. Ideally, it's the family member who has the time and the inclination. And the further away from that kind of frontline delivery you get, the more one size fits all things understandably need to become. But that means that you kind of end up shaving off some of that complexity, and things get less effective, they get less equitable as you do that. This one again is me being slightly provocative, but there is no one best practice. There are good practices for different populations, for different individuals, but if you're treating this holistically, there is not going to be a one-size-fits-all process that works for absolutely everyone. And also, relevantly, when we're talking about funding, and I'll come back to funding in a little bit, traditional return on investment sort of financial modeling of this stuff is really hard, bordering on impossible to do well. I've talked to people from large organizations that will remain nameless that have commissioned groups of economists who will also remain nameless to create a return on investment model for digital inclusion interventions. And they came back after 6 months and said they couldn't do it. So the way that we measure these things fundamentally needs to be non-traditional in some sense. So with that in mind, what I've been thinking about for the last couple of years is, given all that, how do you approach doing change at scale? And so the first thing that I did was some mapping work. So this was 2020, 2021, working with voluntary sector practitioners. So my overall approach was, there are already people doing this work. Maybe a way to create change at scale is to create tools for those small local organizations so that they can do their work better. So I went to some of those small local organizations, and we talked about what they were doing, what assets they had in their work that they were really happy about, what barriers they were experiencing. This is all in a report, which you can see a segment of in the image there, Tackling Digital Poverty in the Northeast of England. I did this in collaboration with Vaughan. It's hosted on their website. I can put a link to it in the chat later. But the outcomes, in very brief, were one, a recognition of complexity. So this is an implication primarily for policymakers and funders that, as we've been saying, this stuff is hard, and the funding model that we're using doesn't recognize that sometimes people need long-term engagement. Sometimes I often think about digital inclusion as being less like a sort of putting someone on a course and teaching them something, and more like care work. And you kind of need to, sometimes it's helpful to think about funding it like care work. Collaboration between organizations. So especially over the pandemic, a huge number of organizations created a lot of innovative ways of doing this. They got very good at serving their hyper-local community. And a lot of that work is duplicated, and a lot of it is going to be lost when people fall out of post in a few years' time. And so capturing that and facilitating that collaboration, building a network of practice around this is something that we thought was really important. And finally, there was a point about training. So practitioners are often excluded themselves, or they're often, there was somebody in the chat, forgive me, I can't see the chat right now, but there was somebody in the chat talking about how we're all to a degree excluded, and that it's this process of continuous improvement. I think that's a really useful way of thinking about it. And there are also things there like, for example, when I was doing, so I did some observation work where I was working as a volunteer in a community center providing this frontline support. And what I spent a lot of my time doing was learning the ins and outs of the half a dozen slightly different GP websites that people needed help with. And so you can think about how a conversation about standardizing those things, which there has been some conversation about recently, could save everyone involved a lot of time and effort. Often this is about, as Tim was saying, it's about the system. It's about making the system accessible. It's about making the system simple and straightforward and pleasant and reducing friction. It's not about raising people up to meet an unnecessarily high barrier to entry. So that got me to this systemic thinking, which I think Tim has broadly summarized better than I can. But some thoughts on what that actually could look like in practice. Thinking about funding beyond this kind of skills course model where you take people, you teach them how to use email and a spreadsheet, you hand them a laptop at the end of it, and then 6 months later they're on the same course again. Thinking about it more in terms of care, but also in terms of large scale interventions. Personally, I think that it's more productive to look at policy, tech sector practices, making sure that everyone is involved in making the system as frictionless for someone who's less comfortable as possible, rather than trying to take everyone in the country who's digitally excluded, all 1.2 million of them, and put them on the same IT skills course. One example of that is some work that I did with the Altitude Foundation. So I'm not going to talk about this a lot, but this is just an example of looking at an access intervention in a slightly different way. So what this was we did some work with 14-year-olds who were from underprivileged backgrounds, who had an ambition to work in tech. This is what the Altitude Foundation does. They're a social mobility charity that teaches young people. They do extracurricular courses in coding and all these sorts of things. And so what we did was we taught them user experience and user research and UI design, but with a particular focus on accessibility, to try and get them thinking about making accessible things very early in their tech careers. Like these are the tech developers of the future. And so the idea was, what does it look like if we get them thinking about these kind of social access issues really early? We haven't fully analyzed the outcomes from that yet, but I would describe it as a solid first attempt. There were definitely some problems, but some progress that is encouraging. But that's just one example of my sort of challenge to everyone today, which is to think a bit differently about what an access intervention looks like. Then this is my current project. So this is the thing that Rachel was kindly mentioning earlier. So this is, if we're thinking about collaboration between these various small organizations, no one organization can be all things to all people. They have different specialties, they have different facilities, they have different equipment, they have interpreters for different languages. And so the idea was, what would it take to set up a referral network so that a practitioner in organization A can recognize a need that they can't meet and go looking for organization B to refer a service user to get the support they need. So I'm not going to go into huge amounts of detail on the design of this system. There's some quite exhaustive documentation that I just don't have time for right now. But if you want to talk to me about this, I'll happily talk your ear off at some other point. But the basic idea is that we would have service providers signing up. They would be able to register the services that they offer, have a concept of what their capacity is like, who they can serve, and then an idea that someone could make a referral. You can see that these mock-ups are extremely ugly, by the way. I promise that's on purpose. People don't criticize things if they're pretty. And then an idea that you could refer someone, you can provide some information, you can talk to service providers to work out where they can actually meet these needs. So you can now kind of have those ad hoc conversations like, hey, I've had a person come in here who needs such and such a kind of interpreter to be present. Is that something that you can do? And then the idea is to make those referrals and kind of broker those connections. Something that also occurred to us in the process of designing something like this is that what you're also doing is generating a lot of information about who's doing what where, which is another big challenge in digital access, just knowing where to send people. And so there's this idea that you're potentially building a lot of data about what's happening, who's going where, and if you strip out the personally identifying parts of that, you, for example, end up with information like there's lots of referral requests that are being sent that require, say, a BSL interpreter, and they're not getting picked up. Does that tell us something about a need to find funding for more BSL interpreters in this area? Those kinds of concepts. So I've been working on this, and there's a very ugly mock-up of what that might look like. So this is something that I've been working on for a little bit. I've been getting a lot of feedback on these initial designs from people in health, but also people in the voluntary sector. I'm engaging with some service users who engage with a digital inclusion service later this week. So there's lots of stuff going on there to kind of iterate on this concept of a referral tool, think about how it needs to be governed, think about how it needs to be funded. There's a lot more there than I really have the time to talk about at the moment. But the upshot is that we can think about, if we're taking this idea of thinking about systems seriously, then we can think about, well, what do systems scale interventions look like, right? And that opens up potentially a lot of space to think about what we can actually be doing. And also a thing I want to highlight, if you look in the voluntary sector, there are already lots and lots of really skilled practitioners out there who do this work really well. And so my challenge to people here is think about what you're doing to make their lives easier and their work more effective. So if you operate a GP website, think about the experience of someone in a library who is supporting people through that service. Think about how similar you are to other services to other GP websites in your area, so that people aren't having to learn half a dozen different websites based on who's coming through the door. There are ways that we can design services with these people who are providing support in mind, because that ecosystem is out there. And if we engage with those people better, then the whole system can work a bit more closely. So kind of moving on from that, quick other aside about future work in this space. If this kind of work, if the kind of thing I'm talking about is interesting to you, my lab recently started work on Northern Health Futures, or North Futures, which is a digital health hub that aims to connect various organizations in terms of digital health and health tech research, enhance digital skills training for various stakeholders, and fund scoping research in and around digital health. All of the local universities are involved, as is Health Innovation. Hi. And way too many other organizations for me to name here. It literally wouldn't have fit on a slide. But if that's interesting to you, there's a website down at the bottom, northfutures.org, with a mailing list. If you want to keep up to date on what they're doing, then that's the place to go. And finally, if you want to talk to me, so I am about to finish the data collection and doing things part of my PhD project and disappear off to write for a while. But I do still have a few more slots available next week to give some feedback on that referral tool. If that's something you're interested in, email me. My email is there, a.w.parnaby2, blah, blah, blah. That would involve being taught through the tool in more detail, giving a bit of a steer, giving a bit of feedback. I'm also conscious that my research project is scoped to design this tool, but not to develop or run it. If that's something that you want to talk to me about in terms of finding a home for this, finding funding for it, those conversations are ongoing. And if you would like to be involved in those conversations, please get in touch with me. And finally, I do also do speaking, consulting, training type things around this sort of thing. If you want to talk to me about that, that's my other email address there. That's my business email. So thank you very much. I think that's everything. If anybody has any questions, I'll shut up now.
That was great, Adam. And I did say come along and be a little bit challenging and give your own perspective, which I definitely think you did. You could see some good responses from some of that stuff, which was fantastic. It's also generated a really good level of chat and chat function. So if you've got a chance, I mean, Leanne will pull that off afterwards and share it so you can see some of those kinds of conversations. I think for me, we haven't got masses amounts of questions, but I do have some for you, as you would expect, as always. Firstly, now you touched on a long-term condition and you know that personal experience accessing NHS services. What did you find frustrating digitally that you thought, actually, how on earth does somebody who's not digital get help with this? What was your personal findings?
So 2 points. The first point is that the NHS app is wonderful, but it is only as good as the service integration with it. So different services will use, like different GP practices, for example, will use different features to different degrees. And so, especially if you're transitioning from one practice to another, or you are dealing with different corners of the NHS that engage with the system differently, it's just a huge amount of work understanding. Like I have had to develop a very detailed understanding of, okay, if it's this kind of issue, I should send a message on the NHS app. That will get me the best response. If it's this, I should call. And that's different for every different corner. The second thing is that I have spent way more time sitting on a trolley waiting while a nurse figures out how the new systems work than I have had benefit from using the NHS app.
And I think that some of the comments in the chat there do touch on workforce skills. How do we support them? So that's definitely, you know, stirred some thoughts and discussion in the chat function around it. So that was brilliant. You touched on why people don't engage as well. So what do you think the top 3 reasons are that people don't?
Okay, so that one is quite tricky because we often sort of break things down between maybe like legitimate reasons and illegitimate reasons. But if you're taking sort of co-production participant engagement seriously, then all reasons are valid reasons. So to answer the most common, technophobia is one thing. It's a real thing. It has not gone away. It's become more concentrated in more vulnerable groups. But how you address that is really quite tricky. And it really kind of comes down to the individual. And it's also addressing technophobia is a dangerous game because the technophobia might be a mask for other much more entrenched issues. And so if you just say, oh, this person's just scared, and if I kind of give them a forceful push, then they'll get over it. Like that was to a degree what universal credit was trying to do when it was digital, when it was first framed as digital by default. And that's largely been regarded historically as being a disaster from start to finish. So technophobia is the big one, but technophobia is often a conglomeration of other things that manifests as technophobia. So I just wanted to offer that word of caution. Other things, there is a degree to which people can feel like services are not for them. This is a kind of social access issue. They're worried about the service not being right for them. They're worried about reduced quality of service. They're worried that if they let themselves be shoved into this digital box, then the quality of service that they're getting will be worse than if they just insistently keep phoning people. And I think that's, again, quite a legitimate concern. Another thing is that people are worried about privacy. They're worried about scams. They're worried about being taken for a ride. If you call the GP surgery, then there's a level of kind of comfort there that you're talking to a person who is accountable. But it's very easy to mock up a website that looks like an official NHS website. And if you don't have the skills to realize that you're being taken for a ride, it's quite easy potentially for very bad things to happen there. And so, again, that's a more serious issue that might just manifest in what people are telling you as technophobia, basically. So that
we're going to move to that's a brilliant response, and I think it's kind of stimulating some thoughts about what do we need to do back out when we're designing, etc. I'm just going to pass to Shirley. Shirley's got her hand up.
Yes, thank you. Sorry to everyone. Actually, I should have introduced myself. Shirley Ryan. I work in the regional team in North NHS England, and I've actually got a foot. I've kind of got a foot in both camps of East and West of the North, so I'm kind of Team North. A question, Adam, and you might not be able to answer it today, but I would love to know your thoughts on it. I'm sitting where I do. We are constantly asked for how do you measure your impact of what you're doing on this, that, and the other. And I'm really struggling to do that because there's some big numbers that you can say, okay, in the next survey, there are 5% more people online than there were last time, but it doesn't feel like a measure. health inequalities, people are constantly saying to me, how do you prove the work that you're all doing is having an impact on health inequalities? Equally as difficult to manage. Have you come across anywhere, and actually I think you alluded to it, and that is just how complex, and it's been a bit seasonal coming in and out, all those kind of things, but have you got any thoughts around how we might be able to show, because being the NHS, somebody said in the chat, return on investment, for us to be able to attract funding, we need to show a return on investment. But hand on heart, I'm really struggling to find measures. So any thoughts on that? And if that's a really complex question, happy to have a conversation with you outside of this, but I'd love to hear your thoughts.
I would love to have that conversation. In short, I think the answer from my perspective, slightly tragically, is the problem is not with what you are doing or that you can't find the right measure. The problem is that the whole framing of this around a sort of crass numerical measure of how this works is flawed. And if there's anyone here who's sort of higher up in management or is doing those kind of accountability and compliance things, this is something that I would love for you to take away. There isn't a good way of doing this. I've been tasked with coming up with these kind of numerical measures for this sort of thing before, and bluntly, someone could come up with a convincing measure. They're all nonsense. That you can talk about actual usage. So, for example, you can survey people and say, there's, as you say, there's this many more people using the service, or the rate at which people are saying that they enjoy the service, that they found the service useful and helpful, has increased. But those are all ultimately proxies, and the actual thing that we're dealing with here is much harder to pin down. I think there's one degree to which you could go back to why we're even here in the first place. It's presumably to improve patient outcomes. So you could go back to that, but then it becomes really hard to prove that your intervention was the one that made the difference when there's all manner of innovation happening in the NHS constantly. I would point at things like there's concepts like horizontal accountability and human learning systems, and operating on a more sort of qualitative case study based model of accountability. I think those are more effective in this space, but that's not a change that you can make as someone in receipt of funding. That's something that the funder is going to have to think about when they're commissioning things.
And I think we'll take that away, Shirley, and maybe see how do we do a bit of deep dive masterclass to give those top tips to people, or because it's a real thing. It's really hard to measure, and it's kind of looking at that longer term. I'm conscious of time. We've got
Rachel, sorry if you don't mind me just coming back up that. I really would like to take that away, because I feel that as a regional team in NHS England, it's incumbent on us to try and influence that thinking. So if we are able to get some of your time, Adam, and yourself as Rachel, and anyone else who's interested,
and probably Wally as well.
I just think there is possibly an opportunity. Yeah, Wally as well.
Yeah,
I think maybe there's an opportunity for us to try and influence. I wouldn't hold my hand up and say we can, but more than happy to kind of give it a go. And you're right, Adam, it's about influencing people, not just coming up with a daft measure that doesn't mean anything. So sorry for interrupting there, Rachel, but I just think it's important.
Okay, don't worry, it's a relevant point. Wally, before we come to you, we've got two final questions. So we've got the lovely Patrick first. So he's one of our patient reps as well, and he's always got a good voice and a good perspective. So Patrick.
Well, I don't know if I've told you this before, but I did a survey of my retirement home with 34 residents. And quite frankly, I think there are 6 of us that are digitally included, and the rest are not. And quite frankly, none of them is the least bit interested. They much prefer. So I worry a bit that we spend too much time trying to think how to bring these people on board. I think we should be designing systems to be simple and easy, and that is the key point. And the simpler it is, the more likely these people might start using it when their children come up and show them how to do it.
Yeah,
that's a great point.
I think you've hit the nail on the head there. It needs to be simple and it needs to be worth it. There needs to be a compelling reason. And if there's not a compelling reason and you find yourself in a position where you're trying to spin your digital service to convince people to take it up, then I would encourage people to take a step back and think about what they're even doing in the first place. It sounds hard. In my field, we call it techno-optimism, this idea that if it's more digital, it's automatically better. And it's just not always true. And so sometimes you do need to take a really critical eye on what you're doing and learn when not to make a digital service.
Good point. And finally, last but not least, Wally. Are you still there, Wally? Oh, I think we've lost him.
I'm here.
Oh,
My
you're there.
apologies.
You're there.
I keep dropping out, so I'll be very quick. Measurements, what Patrick's just said, and I've saw the survey Patrick pushed out, makes so much sense. But trying to measure digital inclusion, exclusion, it's bunkum. It's virtually impossible, and we need to actually recognize that it's virtually impossible. I think it's more of a barrier for inclusion because you've got to have measurements in.
Yeah.
Yeah, that's another really good point. I've seen in a lot of work, because it's so hard to measure this stuff, there's a tendency to sort of over measure service users. And then, as you say, what you're doing there is you're putting up another barrier. That's another page in the form where they need to fill in all of this demographic data that is quite sensitive and that you don't really need from them to deliver.
We're just making it more difficult.
Exactly.
Sorry, Adam. We're making it more difficult for people to access digital, those who want to, which is another really important point. Because of the way we've got things set up, it's a system issue. It's not an issue for the people we serve. It's an issue for us, and we'll keep making it more difficult. You just accept the fact that this is unbelievably difficult to measure, but let we have the opportunity because of the listening we've undertook with people and the engagement we've had, that we need to be doing it this way. And that's an organizational, right the way across the system, that's an organizational issue we need to shift. But unfortunately, because of how we're set up and how our funding mechanisms work, make that unbelievably difficult.
Definitely. That was great. So one final comment from Patrick. We've just about got enough time, Patrick. Oh, you're on mute.
I just wanted to say the key thing to do is to get the GPs to identify on their records whether people want to deal digitally or not, so that I want to be digital because I can't leave home, but they won't use digital because they don't have my records.
That's great. Thank you for that. So very finally, I thank you so much for that, Adam. It's generated lots of discussions and idea to move forward around how we look at measurements. So we'll be in touch and set up a little steering group or a task and finish group to explore that. We've got some internal resource, Ellie Mitchell, or she has just been married, so I can't remember her new surname, but she also works for NEQOS. So she's kind of into that data specialism. She's got a PhD and done a lot of research in this, so we can tap into her expertise here at HYNEC. And just finally, I just always try to share a little bit of best practice. So I will just go back to using my slides if I can work out how to do it again. So just bear with me. Just on that one there. I'm assuming everybody can see that. So we'll just do a little tiny bit of best practice in the 4 minutes. So we've got our Digital Champions programme, which covers a digital inclusion. We often look at that as part of that agenda. We've got the final session for primary care staff who want to become a digital champion on the 5th of December, and it is a accredited course, so they get their CPD accreditation if they complete that course. We shared this the last time, but it's just to remind you about this. This is the general practice digital inclusion 10 top tips. I won't go through it, but it's just to put that on as a reminder. We also have those who understand that the framework has come out inclusive digital healthcare, and they are running a webinar on the 20th of November. When we share the slides, there's a hyperlink to both of these and a hyperlink to register for that event. I did also mention in the chat, I was just going to mention about the workplace, because this is often something that we forget and leave behind. Is how do we support and ensure that our staff have accessible information? How do we support them? How do we provide training? How do we create our own champions within our own organisation? We do certainly internally at High Nenk, you know, we've got wellbeing champions, EDI champions, we've got digital champions, we've got Omnia champions. So it's just about, you know, taking that way. If you don't do that in your organisation, how you can make some changes to put that into place. And also about making adjustments for staff. So somebody who might have a disability or who needs a reader, etc., making sure that you can provide that. And then there's also the Digital Accessibility Standard, which is an ISO standard. So for those who are developing any type of website, etc., or services, then you just need to consider that. Moving on, the Citizens Online. If you haven't seen their website, there's a hyperlink in there, and that provides a lot of useful information. We talked about privacy and safety, so kind of bite-sized chunk videos, same as Barker's Digital Legal and the Good Things Foundation. There are a lot of resources out there to support people to increase their confidence levels in there. And our lovely Leanne, who's on the call, designed this last week for an event that we attended at Sunderland University, and it's a pledge about, you know, so if you're running any internal events, you connect them with anybody, Leanne's more than happy to share this, and it just kind of says, you know, who I am, what I'm pledging to do around digital inclusion to make things, you know, more inclusive in my work area. So we will be able to share that. And very finally, we have a short video to show you, and then we will end the call. It might take us over slightly by a couple of minutes for those who can stay on.
I get it at work. Oh, how can you not have internet? You've got to have internet to be able to do a lot of things, and it's like we're not in that much to warrant having to afford it. You can't always afford it.
So my name is Hadissa Hussein. I'm a student, and I was born with facial disformity, which affected my eye. Only recently, I wanted to do like an online banking app, but when I tried to do the face recognition and it couldn't read my face, it made me very frustrated. Like for 3 hours, I was trying to do whatever, and it couldn't pick up my face. It couldn't recognize my face.
My name's Zach Anderson.
And I'm his mum, Donna.
When COVID was here, it was very hard for me because we were staying home and there wasn't enough Wi-Fi at our house.
We don't have Wi-Fi, do we?
Yeah.
No internet. We only had mobile phone internet, that's all we've managed to have. It's not very good signal in our area anyway. He ended up having to come back into school anyway because he was struggling with the learning process at home and being at home. Parents' evenings and stuff like that, even that was all online, which on our first one, I think we missed half of the teachers because we didn't know how to do it.
When it was locked down and we didn't get to do that much, most of the time I didn't even get to spend time with my friends.
I'm Vivian Stebbing, I'm 76. I decided after I lost my husband, I'm going to make a resolution. I'm going to learn how to work the computer. It's just that everything was online, and I felt that that was it, that I'd get left behind.
Everything was being really tough. We phoned school, and school said that we could help you. So then they gave us the dongle. That really helped a lot. So then I could get all my work done.
They provided you with a laptop as well, haven't they? So,
which is good.
Which helps him with his work.
From Henshaw, they helped me to set up my Mac. The other thing I use in daily basis is my phone, and I've been using Microsoft Soundscape, I think. So when I travel somewhere, I turn that on, and it keeps talking to me about my surroundings, and it tells me what is in my right, what is in my left, what is in front, what is in the back.
I used to go to the Lifestyle Centre in Woodhouse Park, and they did IT there, so I joined. It has been such a help, and now I have a computer, laptop, iPad and an iPhone, and my 56-year-old daughter wants me to teach her.
We have to think about different people who has different difficulties. For example, someone who is completely blind, we need to work with other people or other communities to bring that change.
So that was just to share that little snippet and bring us back. Just remembering that at the end of all these services is a person who needs support. So I just think that's a really pertinent video for all the work that we do. Even though it isn't in the northeast, it's a Manchester one, but I think it certainly gives a message out. So I'd like to thank our presenters today, both Tim and Adam, and for all of those who've contributed. I think it's been a really great session, and we look forward to seeing you in the new year. How scary is it saying that? We'll see you next year.